Hi, in today's video, I'm going to talk about a review of therapies for diabetes, help you to change your own lifestyle and to be healthier. As you know, diabetes is a condition that affects blood sugar levels, and causes many serious health problems if left untreated or uncontrolled. There is no cure for diabetes, but it can go into remission. Usually, people can manage it with medication and lifestyle changes. Let's talk a little bit about type 1 diabetes. It is an autoimmune disease that develops when the body destroys the cells in the pancreas that produce insulin. This means that people with type 1 diabetes do not make insulin. Without insulin, the body cannot regulate the amount of glucose in the blood. But people with type 2 diabetes develop a decreased sensitivity to insulin, which means the body does not make or use as much insulin as it needs. It is the more common of the two main types. Is diabetes curable? When diabetes goes into remission, it means that the body does not show any signs of diabetes, although the disease is technically still present. With that, doctors have not come to a final consensus on what exactly constitutes remission, but they all include A1C levels below 6% as a significant factor. A1C levels indicate a person's blood sugar levels over 3 months. Even if a person maintains normal blood sugar levels for 20 years, a doctor would still consider their diabetes to be in remission, rather than cured. Achieving diabetes remission can be as simple as making changes to an exercise routine or diet. With type 1 diabetes, we can see it as an autoimmune disease that often develops during childhood. It occurs when the body mistakenly attacks the beta cells of the pancreas, removing their ability to produce the insulin that the body needs to use blood sugars correctly. And when receiving a diagnosis of type 1 diabetes can be daunting, yet many people manage the condition well, keeping symptoms and severe complications at bay. Currently, it is easier for a person to reverse type 2 diabetes than type 1. This is because type 2 diabetes is not an autoimmune disease, and a range of outside forces and lifestyle habits can make it worse. While this means type 2 diabetes is much more widespread than type 1 diabetes, it also means that a person with type 2 diabetes can make relatively simple lifestyle and dietary adjustments to bring their blood sugar levels back into the normal range. Dietary intake and obesity both play a critical role in the development of type 2 diabetes. As such, people can reverse the symptoms of type 2 diabetes by adhering to specific lifestyle changes that include improving their diet and exercise regimen. Do you want to discover the simple 60-second habit to reverse type 2 diabetes without any exercises, dieting or insulin? Find out in the link below of description of this video. It'll explain in details on that link's video. And how exactly you can use them to reverse your diabetes type 2 easily. Thanks for watching. And I'll see you in the next video.